Good morning. Oh, happy Ehlers-Danlos May Awareness Month. I'm doing video files this month instead of, or video this month instead of written because I think it's going to be quicker. Day 2 is my diagnostic journey. So my diagnostic journey started about when I was 19. I'd been having symptoms. Really, I mean, when I look back, hindsight is 2020. Uh, my symptom journey started really when I was about 10 that I can remember. It started with some GI issues. It started with some blood pressure issues that really looked like kind of like when you get hangry, when you've gone too long without eating. But now we know they were really blood pressure issues, blood pressure getting too high, electrolytes being out of balance, and then looked like an angry child sometimes, I guess, to other people who didn't understand. So moving through puberty, my symptoms got a little bit more advanced. I certainly had hypermobility. I had scoliosis diagnosed when I was in 6th grade. And I had some eyesight issues. I remember early on when I was really young, and just kind of keeping an eye on that about how far I could see and what I could see. And then the scoliosis when I was in 6th grade was diagnosed. I had a lot of back pain. Maybe didn't walk exactly right. And then the GI issues. I had some skin issues with sores that I would get that maybe we can figure out where they were coming from. Some viral illnesses with my tonsils and strep throat a lot. And yeah, lots of illness like that when I was younger. Moving on to junior high, I'd miss a lot of days at school because of stomach pains that I just could not get ahead of. Everything seemed to make me sick, and I had pains all the time. And then we'd go to the doctor, and the doctors just could not figure it out. They eventually thought it was stress, and there certainly were reasons for stress that we could write it off to. But now, you know, I've I've had these issues my entire life, so I've been in and out of stress my entire life. It's not just stress. So about 19, my hip really was getting bad. So it had started in my teens, where every time I would run, it would pop, and people around me could hear it pop, and I just thought it was normal. I lived in this body. I thought everybody's hips popped when they ran. Apparently not. So I could do the flexibility box really great. I had a lot of flexibility. I could run on all fours pretty darn good, better than a lot of people. Um, yeah, things like that. Very flexible. Could bend over backwards while standing up straight. So at 19, when the viruses I'd get sick with a virus and I could never shake it. Like most people will get over them in like 2 to 3 days, maybe 5 days. Mine were lasting a month at a time. And to the point where people were starting to make comments about how sickly I was and how I seemed to be pretty healthy otherwise, and really kind of getting negative comments about how sick I was all the time. So I got sick one time, and I went in to the doctor, and they just, asked their question, "Are you in pain?" Yes. Finally got taken seriously. She asked where the pain was. It was in my back. Bent over backwards at my hip to show her my range of motion, and she screamed a little bit, and I'd never had that kind of a reaction. And she said, "Stop, please don't do that." She caught my back, pushed me back up. She said, "Are you able to do more than that?" And I said, "Oh yeah, I can bend further than that." And she supported me to see how far I could bend backwards, and she said, "Please don't do that any further. That is way outside the range of motion of what you're supposed to be able to do." And she pushed me back up to standing straight, and she sat me down. She did as close to what the Beighton score is that they diagnose hypermobility on now. Part of hypermobility. It's not fully the Beighton score, but that's the physical part of diagnosing hypermobility. And she said, "I am pretty certain you have EDS." And she brought the doctor in. Her and the doctor were in the room, and they said that both of them had been to an EDS conference the month before or something to learn about Ehlers-Danlos, and they were both fairly certain I had this. And they thought my skin fit the condition. They felt my hypermobility fit the condition, and my illness and everything else fit. They were pretty certain. And they didn't say anything necessarily about how to go about getting diagnosed with it. They just felt I had it. Being 19, 20, you're invincible. Why would I go after getting an official diagnosis? You're telling me I have this. I asked them what to do. They said, "There's no cure. We don't really know much about it. We just know that it's going to cause early onset osteoarthritis. It's going to be painful, and the best way to combat it is to eat healthy, lose weight, and be active," which is pretty much standard fare. It's what all of our doctors are telling us to do, right? So I went home, and over the next year, my back really started to hurt. So everybody tells you to go to a chiropractor. So I went to a chiropractor who took full x-rays and notated a lot of damage to my spine, and asked if I'd been in a car accident. Nope. And said, your C6, C7, which are the last two vertebrae in your cervical spine, were fused. And not having been in an accident, he said, "I'm pretty certain they've been fused since you were born." And that would mean that it's a congenital fusion. That's rare, but it does happen. And you need to be aware of that, because if you're ever in an accident where they need to move you, people need to be aware of that so that they don't break those, because that will cause injury. So then he notated that spot where I was able to bend so far backwards in my spine. It's in my thoracic spine. And he said there's already damage there, and it looks different than the rest of my spine. So I classically have called that my hinge point in my back. It's actually more like a joint than it is vertebrae. And it's the most hypermobile spot on my body. So it's the one that causes all of my problems for the most part, next to the vertebrae in my neck. So after that, I've been in and out of PT for a long time. Every doctor that I've had over the years, I've gone into, and I've told them that this doctor that I had seen when I was in my 20s suspected EDS. And for the most part, the doctors know what this condition is. They've heard the term. They've kind of nodded their head, and they've heard me explain what the doctor told me about it. They don't notate it on my chart, and we just move on through the appointments, and they hear my side of it, and we just continue on doctoring. Nothing's ever really done. I kind of feel like we went that way until a major event happened, and it did happen about 5 years ago now. I had an unknown event of, like, what the doctors want to call extreme panic attack or anxiety. But what actually happened was extreme high blood pressure that they could not control. I couldn't control, and nobody can explain why it happened. It rushed me through. to getting diagnoses, that's what happened. When this event happened, things in my body felt completely different. You're going to notice that 5 years ago was the pandemic. So everybody's going to say that's what it was. I'm going to tell you, I wasn't sick, hadn't been sick, hadn't had those symptoms. I have never tested positive, ever. People in my household have had it, have tested positive. I have had their symptoms at the same time. I have never tested positive. So I am kind of an enigma. And I had not had any countermeasures. So clean. And I have this event with blood pressure. And I end up in the emergency room at 6 o'clock in the morning. Super, super high blood pressure. Can't get it to come back down. Not sick in any other way. Super bad anxiety. Super, super bad. And they take blood tests, and the only thing that's off really is potassium. And so they start to treat me for high blood pressure, but they don't really know what's causing it. And over the next week, I get worse. And I'm having, those are my support pets running through the house chasing dragons. I have worsening anxiety. I have what we come to know as POTS events happening multiple times, where I'm getting dizzy and I'm passing out and I'm feeling the heart flutters and everything else. So it really got bad. I stopped eating. I stopped everything. We couldn't figure out anything about what was happening, and I was getting sicker and sicker, and I literally felt like I was going to die. And I went back to the emergency room feeling very stupid because what's going on? Nobody can figure out. Nobody can tell me everything. All the tests are coming back normal. Classic for EDS. All the tests are normal. And I end up back in the emergency room where they tell me again the potassium is low, except this time it's at the low point that if it goes any lower, we are going to have a problem. So they give me more potassium. They tell me to eat more potassium, send me back home to get more doctor's appointments. And we find that I have a heart murmur. We find that I have mitral valve stenosis. This is particularly what green lights me through, because if I do have EDS and it's undocumented, and I'm in my 40s at this point, if you do happen to have the bad type of EDS, which is vascular EDS, we need to know that right now, because that's the bad one. And if they don't know it, you're going to have vascular involvement. That means your veins. That means aneurysms. That means happening now. That means that could be the root cause. So we need to get that diagnosed immediately. We need to have scans. We need to have that figured out. So that green lit me through to finding out what's going on. That got me to the rheumatologist, who ruled out everything, because EDS diagnosis is diagnosis by exclusion. So you got to rule out everything else first. Lupus, Sjogren's, rheumatoid arthritis, Lyme disease, fibromyalgia. There's a whole host of lots of different diagnoses. I have been tested for everything at this point, and multiple times. And finally, the rheumatologist at the end of the appointment says, have you heard of this condition called Ehlers-Danlos? And I said, I wish you would have led with that, because that's what I'm pretty sure I have. But I'm going to play it cool this time, because at this point, we're after 2017, which is the big conference where all the criteria about EDS has come out, and everybody is starting to get more and more aware about EDS. And I'm finding out that there's so much more information out there than just causes advanced osteoarthritis and hypermobility, and like we don't know anything else. Like we were starting to know a lot. So I'm gonna play it cool, and I'm just gonna like start from ground one, and let's do this. Let's get the diagnosis. So I told her, I said, like, I've had the doctor in my 20s, the chiropractor noticed these things. I can't get my hands on those records anymore. They're too old, they're too far gone. Like, I can't, so we're gonna have to start at ground zero. And she's like, your skin really on its own is clinically diagnosable as EDS. And I'm like, really? Okay. And we take new scans. The degeneration in my spine is really, really bad. And it's not only just the hinge point in my thoracic spine now, and it's not just the 2 vertebrae in my neck now. It is my entire spine, from the top of my cervical spine to the base of my sacrum. Every single spine, every vertebra is involved, and to some level of damage. And she says, your symptoms from this event that has just happened sound like a stroke. And I said, well, that's kind of what I'm learning. Um, and she's like, so we're going to send you over to neurology and make sure that you didn't have a stroke of some kind. And we need to do that fast because they need to know that within 30 days. So I got my referral to neurology, and I got a referral to genetics to rule out vascular, okay? Because 13 types of EDS, 12 of them have genetic markers. Genetics can diagnose vascular EDS genetically. So vascular EDS is one of the 12 that can be diagnosed genetically. That's why you get sent to a geneticist. Hypermobile EDS is the only type at this time that cannot be diagnosed genetically. Remember, EDS is diagnosed by exclusion of everything else. So hypermobile without a genetic marker has to be diagnosed by exclusion of everything else. You're going to have to be diagnosed either clinically or exclusion. Because I had heart involvement, we have to exclude vascular. Now, the further thing is, right now, we're getting really close to possibly having some markers to help us identify hypermobile. We're right in that period this year where there are some other testing going on that's going to possibly help us get there with that. So at this time 5 years ago, they're going to send me to genetics. And genetics was like a year-long wait to get to. So I go home and like, this is a big scary thing, genetics, right? Like, who wants to know their genetics? Now we're playing God. But we need to know vascular involvement. And I don't know how fast I'm going to get into neurology because now we're post-pandemic and neurology waits are really long. And I get a call that they're green lighting me into neurology within like a week. So I'm really getting, for the first time in my life, I'm really getting really good treatment here. And genetics calls within like 3 days and they want to see me next week. So not only that, but I'm in an area of the country where my family, live like 3 hours north of where my family farm is. And my family farm just happens to be within 30 minutes of a geneticist that is working on the hypermobile EDS genetics project at that time. So, yeah, where am I going for genetics? Yeah, that's where I'm going for genetics. So that's where I went. And so sick, screwed up my genetics appointment so bad. I've got lots of helpful hints for that, for it not to go that bad next time. So we ended up looking at the causes for why would my potassium be so off, and totally missed the boat on, let's get EDS actually diagnosed. So we missed having the EDS test done right then. Again, I was really sick and not in my right mind at that point, and not really should have had an advocate with me. And if you know me, I am the advocate in my family. I am the advocate. I needed an advocate. I didn't have it. So I I talked to her, and I kept talking to her, and I kept talking to her, and that test came back negative for a genetic marker for potassium issues. And I kept sending her emails, and then I finally got to a moment of clarity a few weeks after that and said, I missed the boat, and here's my full timeline of events, and this is what's going on. Once they get your genetics, they can run it again. And she did. And 3 months after that, I got called in for another appointment, and she said, I didn't expect to find what I found. I found results, and you are on the EDS spectrum. And I missed that. So she had diagnosed my skin as being part of it. And during this time, my hip is failing, right? So I can't pass the Bite score in the office at all. I can pass it historically, which is what's supposed to count. But in the office, I can't pass it because my hip is actually gone at this point. And so my skin passes. I have lots of other indicating factors that pass. So that puts me on the spectrum. And she definitely gives me a connective tissue disorder diagnosis on the spectrum with EDS diagnosis. And something else is going on, clearly. Diagnosis. Walk out of that, get to neurology. Definitely an EDS diagnosis. Okay, now we're starting to stack them up. That's how you get to diagnosis, by the way. Move on from that. Things are not going well. I can't quite do my job. I'm starting the Social Security disability process. It takes a long time. I've been denied. I'm still in the process. 5 years have gone by. I think last year I had a functional doctor exam and a neurological exam. It was enlightening. I got issues. I got neurological issues. I've really tried to hide them a lot. And that's why diagnosing has been so hard, is because I've tried to hide them really well. I've gotten really well at hiding them. And I have to not hide them in order to track them and mark them down and get good data for the doctors. So I had this functional doctor come in who was cold to the case and diagnosed me after hip replacement. Okay, so now I don't know, 8 months after hip replacement. And she diagnosed me with so many more hypermobile joints than the Bite score could ever diagnose. And said that the fact that I had fused vertebrae in my neck and I have more than full range of motion in my neck than most people is astonishing. And that my left hip actually is hypermobile when we didn't think it was hypermobile at all. Okay, so now we got to take care of the left hip. Yeah. So this is the path to diagnosis. Like you get to diagnosis, but the real piece that you want, see, the geneticist is what they're wanting right now. You're wanting your paper from the geneticist to say that you have EDS. Yeah, I mean, like, that's your pedigree. You want your primary care doctor to understand EDS, because you're going to go home from your geneticist and you're going to be like, okay, so now what? What do I do? How do I live? How do I function? Because now we know what it is. Now we know what to call it. It's not Sjogren's or it's not Lyme disease. I'm not down that path of treatment. What do I do? And your recheck appointments are going to be with your primary doctor. And if your primary doctor doesn't understand this, you're on your own again. and you're back to square one. So I've had very candid discussions with my geneticist who is EDS aware. She's smart. She's so kind. She's so compassionate. She knows this condition. It's important for her to put you in the right category with EDS, which is why she put me on the spectrum, because she's collecting data on all of us in order to find the cure, right? But she sends you back to your primary care doctor, who's going to live with you and treat you. And you're going to get frustrated with them if things don't work right. And if they don't understand your condition, what difference does it make? So what you really need is you need your primary care doctor to diagnose you clinically. So there's a difference. There's a difference between a genetic diagnosis and a clinical diagnosis of Ehlers-Danlos. What you really want is a clinical diagnosis of Ehlers-Danlos, because you have to live with it and your doctor has to treat you every 6 months to a year. Okay? That's what you want. You want your clinical diagnosis. If you have vascular, you need to know you have vascular, right? But you want a doctor, a primary doctor, to clinically recognize who you are. It's hard. I loved my primary care doctor. I tried and tried and tried, and she just didn't seem to understand. And I found another doctor who knew, and the treatment is different. And inside of 6 months now, I'm better, even though it doesn't seem to be that I'm better. It's because it's a whole process, right? I'm unmasking to get the neurological symptoms, but yet I've got the stomach issues, but yet I've got a doctor who knows how to treat it, and we're adjusting the nutrients. It's a process. It's always going to be a process. Life is a process, and you take it one day at a time. And you're just trying to get to a place where you're better. That's why you just focus on living and trying to find a good place of living and what you can deal with. I didn't do a video visit yesterday, and I'll tell you why real quick. I celebrated May 1st and the opening of Ehlers-Danlos Awareness Month with a colonoscopy. It was routine, but it was really to try to start the process of figuring out my stomach issues. It didn't help. It was a normal test, which is what we always get. We get normal tests on everything, which doesn't really help much because that means there's going to be more tests, which means more money, which means more insurance, and our insurance this year sucks. So the prep wasn't friendly, and it wasn't friendly, and it went the way that it normally does for a lot of EDS people. And it dehydrated me a lot, and it left me with a migraine and a lot of joint pain. I had it all gone for about 5 months, and it was really wonderful, and now it's back. And I woke up at midnight last night. My left knee had locked. Not locked. It had dislocated. Something had. So either the patella had dislocated fully out of position and my knee was stuck in a 45-degree angle. And when I was finally able to get out of bed to try and address this issue at midnight, and the pain was ungodly, to the point that I needed to get to the bathroom, ungodly. And when I was finally able to stand up with the help of my husband, who was exhausted from caretaking me all day and getting me to a colonoscopy and dealing with being dehydrated and having all my lovely anxiety on full display, I realized the lower half of my leg past my knee was stuck at a 90-degree turn towards my right foot. Nothing wrong with my ankle or my foot. So whatever had dislocated in my sleep had turned the lower half of my leg towards my right foot. It's gross to think about. It's even horrifying to have that much pain and wake up at midnight and find that your leg is in that kind of a position. And I can't get it back out of that position. Because each attempt to straighten my leg is met with fresh pain and not moving, not responding. My foot is responding, so I try to step down on my toes to try and walk, and I can't. I can't weight bear at all. And standing there waiting, my husband is trying to get upstairs to get the walker so that I can get to the bathroom. And it was bad. It was really bad. And it was about 5 minutes of sheer agonizing pain until the dislocation corrected itself with gravity, which was really hard, and it popped. And now today I can weight bear on the leg, and it's swollen and it's painful. So this is EDS, and this is following a procedure that dehydrated me. So this is what happens. Like you know there are going to be things. You just don't know what the things are, and you don't know when they're going to happen. So this knee, they've been telling me, needs to be replaced for 12 years. Like there's damage in it. Yeah, whatever. There's no pain in it because I don't feel pain like that anymore. I don't feel like pain, I think, like the rest of people do, because I've masked that part of me, or I've just, like sensitized myself to feeling so much pain. Pain is a daily thing that I feel. But the pain last night was off the charts. We were getting the walker so that I could go to the hospital to get somebody to fix my leg, because I couldn't fix my leg myself. That was the first one I couldn't fix myself. I can usually fix my joints. I can put my thumbs back in when they dislocate. I can usually fix my knee when it dislocates. This one was bad. I never had my foot turn like a freak show. Usually it gets stuck at about a 45-degree angle forward. It doesn't get stuck 90 degrees off to the side. I didn't tell my husband that part. Because it's scary for people that your body does these things. But this is what EDS is. Like, you wake up and this is what you live with. Okay, so that's the diagnostic journey. You don't just run to the doctor every 5 minutes. You learn which injuries require addressing. Like, if I can't get my knee to unlock, then I'm going to need somebody who knows the anatomy of a knee to help manipulate it into place, which is what I needed last night. So thank goodness gravity did what it needed to do last night. I think a tendon got stretched and pulled under a patella. I think a patella was out of place. I manipulated it around as best I could for 15 minutes and I couldn't get it. I stood and I tried to move my foot around. It wasn't helping. These are what happens. And the whole time my shoulders have been sliding in and out and have been popping like crazy. So that's the diagnostic journey. This one's a long one. I was trying to keep it short, but that's it. Usually what ends up happening with EDS people, it's long when you actually ask them the journey. That didn't even get into the neurological issues we've been dealing with lately. So those are just the physical ones. So have a good May. Let's learn about some EDS things, and I'm going to share some of the new stuff that I've been learning. So have a good one. Be careful with everyone around you.